Sorry for the distraction of the bandage. Believe me, you don't want to see it until I heal. I got fascinated by the transformation of Finland from the lowest life expectancy of any country in Europe to sneaking up on some of the best. One of the key doctors behind that transformation is Pekka Puska, virtually unheard of in the US except among nutritional scientists where he's revered, but very well known in Europe.
It's good for me. So good
good.
morning or good evening for you.
Yeah, I want them to get some sense of what's going to happen over the next however long we're on.
The North Karelia project was started in 1972 in eastern province of North Karelia, Finland. And the background was that Finland had the highest coronary heart disease mortality in the world, particularly in eastern Finland. And there was a petition by local people, do something. And we, as a young research team, started to think what to do. And we realized that there is a pretty good evidence on a number of risk factors, particularly smoking, cholesterol and blood pressure. These factors, we need to influence these lifestyles in the whole population. And after 25 years of intensive, comprehensive work, we could see extremely good results. All these risk factors had reduced, smoking had reduced, blood cholesterol levels had gone down. And the best thing was that the annual mortality of heart disease among working age population had reduced by more than 80%. So it was big success. I could never ever have believed.
Somehow you worked with the dairy industry. There was a Finnish guy in our comments section who said you were treated pretty roughly by the dairy industry, but you had this initiative of dairies to berries.
Yes, of course the farmers were very suspicious because you must realize that butter was and still is very deep in the culture. And during the World War, bad war years, people were suffering, there was no butter. And so the farmers, and it was their livelihood, they were very suspicious. And of course the local big dairy was very suspicious. But I think in that area we could pretty well deal with them because the people also saw that it is question of extremely bad problem of heart disease, and probably there's something true in what the scientists say of the solid science.
So the solid science raises a question. You started based on the results of the 7-country study, Ansel Keys, the Mediterranean diet. And
yes.
did you ever waver? Because there's been this wave after wave after wave of popular low-carb diets. Back in your day, there would have been Atkins, and now there's paleo and keto and carnivore and primal and everything else. But did you stay the course with the Mediterranean diet?
Yes, over the years, year after year, there's been all kind of discussions, all kind of criticism to this kind of principles, theories of Ansel Keys, and this whole fat, cholesterol, heart disease hypothesis. But I have felt that the scientific community, I think, has been always solid that this information stays. Of course, we learn more and more about the etiology of heart disease, but I think there's no doubt that this is a very solid information. And I must go back and repeat that when we started the North Karelia project, we did never say that this is the only answer, but we said that this is a huge problem. There is very solid information that cholesterol, diet, blood pressure, salt, and smoking are very influential causal factors. Let's reduce these factors and see how much it helps. And that's what we've done, and it's helped enormously.
It's been a revolution. It's been amazing. Ansel Keys in the day was a household name in America, and it was in a day when scientists were highly respected. These were Time Men of the Year, the same year that Ansel was on the cover of Time.
Yeah.
And now he's vilified on the internet. How is he thought of in Europe? Is he remembered, or is he a hero or a villain?
I think in the scientific circles, he is very respected. But of course, in the internet, there's the same kind of critics are around, even in Finland. But I think the mainline thinking among the scientific community is very, very positive. Because there's enormous amount of evidence from different kind of stories showing always the same thing, diet, cholesterol, heart disease. Of course, there are many other factors influencing. Speaking of Ansel Keys, we must remember that during the time when Ansel Keys and Martti Karvonen started the work in Eastern Finland, Martti Karvonen also directed a study that received a lot of criticism, but which was influential even for our project. That was the mental hospital study. They started in 19 and Martti Karvonen also directed a study that received a lot of criticism, but which was influential even for our project. That was the mental hospital study. They started in 1960 in 2 mental hospitals in Finland where the patients stayed for years. They simply changed milk from fatty milk to skim milk with soybean oil, and then they changed the butter to vegetable oil fat spread, and after in one hospital. And in that hospital, compared with the comparison hospital, cholesterol levels went down and heart attacks went down. And after 6 years, they switched over the hospitals. And in the new hospital, in the other hospital that now had the experimental diet, cholesterol levels went down and heart disease went down. And that was a striking demonstration, although of course there are a lot of scientific flaws you can criticize, and there has been a lot of criticism to that study. But I think it was a powerful demonstration.
Yeah, so Ansel Keys has the reputation of starting the low-fat craze in America, which doesn't check out. But even the Keys equations, which I think he created way back in 1965, he showed that saturated fat raised cholesterol about twice as much as liquid vegetable oils reduced it. But he did say that vegetable oils reduced it. Now in America, there's this, concern about seed oils. Where do you stand on that?
Well, when we speak of fat, of course, it is not a question of fat as a whole. It's a question of what kind of fat are we talking about. There is saturated fat, there is unsaturated, polyunsaturated fat. And the problem, of course, in Finland was that there was enormous amount of fat, and that was nearly completely saturated fat. So we started with the message, reduce the fat, because that meant reducing saturated fat. Of course, over the years, we have paid much more attention to the unsaturated, so much more to the quality of fat, so that it's no more in Finland a question of total amount of fat. It is very much about the quality of fat. Of course, there is a more scientific discussion what kind of unsaturated fat, what kind of vegetable oil. But it is quite clear that there are differences between different kind of vegetable oils. But I think that is still a minor thing compared with the original idea. I think PS ratio is still very important. Concerning vegetable oils, one thing which was very helpful to us in North Karelia was that originally when we said to people that you should switch to using vegetable oil, that was imported, sunflower oil, soybean oil. But then the Finnish scientists were able to develop a rape plant that grew well in the north. And since that we've had a lot of rapeseed oil, or the canola oil as you call it, and that has become extremely important. And I think also that the composition of canola oil is extremely good. But still the big thing for me is reducing saturated fat and moderate increase in polyunsaturated, and that is changing the PS ratio. And that is what has happened here.
And do you have an opinion on coconut and palm oil?
Oh yes, I think palm oil and coconut oil are not as good. When I was director of the chronic disease prevention in Geneva, we published a pretty famous report on diet and prevention of chronic diseases, by the way, which recommended reducing sugar to below 10%, which created a lot of opposition from the sugar industry. But also as part of that, we said that particularly palm oil is not a very good oil. And I had a number of ambassadors from those countries opposing that. But I still think that they are not particularly good oils.
Do you think politics in Finland is a little less vicious than in the U.S. because we have these big food conglomerates in the